about that. Also, is the food that you are currently eating making you even more hungry? You'll want to hear all about metabolic syndrome.
I believe in this.
I believe in this too.
And welcome back. On the surface, it looks like America has an obesity epidemic, but some doctors say the real problem is that we're just hungry all the time, and the culprit is that we're eating foods that actually make us hungrier. And more importantly, we're eating foods that are causing a set of health problems called metabolic syndrome. 9 News medical reporter Dr. Stephanie Clements talked with the doctor who helps his patients kick the hunger pains that trap us all into overeating.
He came by his love of eating, honestly.
Anthony Marinucci, and I'm full-blood Italian.
An Italian-American, 2 eating cultures adding up. But just a couple of years ago, Tony Marinucci was diagnosed with diabetes, blood sugar levels dangerously high. He met Dr. Jeffrey Gerber, who recognized the real problem.
A condition known as the metabolic syndrome is really the epidemic.
Metabolic syndrome is a constellation of 4 key symptoms: excess body weight, cholesterol and triglyceride problems, high blood pressure, and pre-diabetes.
A recent estimate was 57 million people may have the metabolic syndrome.
Why? Because we've been eating the wrong fuel, sugary, starchy foods that actually make us hungrier.
The problem is not that we're overweight, but we're hungry all the time. And why is it that we're hungry all the time? And this is very new stuff.
Our carbs and sugars provoke a sugar high, then dump us to a nasty sugar low.
And we crash, and we burn, and we're hungry 2 hours later. So what do? We go out and get a high-carb meal, and it's a vicious cycle.
Dr. Gerber switched Tony Marinucci to eating foods with a low glycemic index, complex foods that digest slowly.
Lost 40 pounds, 30 since I've been going to Dr. Gerber.
He only gave up potatoes, rice, bread, and corn, and already his diabetes is much better.
I'm never hungry anymore, hardly.
Tony is intent on warning all of us.
If I'd known it, I wouldn't have diabetes right now. If I'd have known this, years ago.
Our goal is to control hunger, and the rest will all fall into place.
I'd like to lose 20 more pounds, so I keep on it.
And keep proving that what we eat can be good medicine. Dr. Stephanie Clements, 9 News.
Now, Dr. Gerber points out that a cheese omelet, for instance, is low glycemic. But as soon as you add the hash browns and the toast to it, insulin levels shoot up. The body then goes into storage mode and stores both the fat and the cholesterol from the meal, and that is a prescription for a heart attack. The better option would be a low-fat cheese omelet with yogurt or walnuts on the side. It does make sense.
It does.
You can find out more about metabolic syndrome and how to prevent it by calling our Doctor Line 9 today. We have physicians from the Colorado Medical Society fielding your questions about weight loss, including gastric bypass and the latest in weight loss drugs. The number to call, 303-698-0999. 698-0999 until 6:30 tonight. That looked like it was Dr. Gerber sitting there.
Was he in our,
I think so.
Could be here. Good for him.
Perhaps.
Potatoes, rice, bread, and corn.
Right.
Are the things that he gave up, and
he
he
gave
lost
that.
40 pounds.
That's a lot. It does make sense about the combination of foods and why some foods really make you hungrier.
I don't know. You and I cannot live without bread. This is a problem.
It is a big problem.
We should go in and talk to the doctor. Physicians who specialize in family care and weight loss are answering our Doctor Line 9 phones this afternoon. If you're trying to lose weight, and who isn't, you want some healthy advice, call 303-698-0999. The doctors will be here until 6:30 tonight.
Now that the holidays are over, many people are getting serious about losing weight. We have physicians from the Colorado Medical Society offering free advice about weight loss until 6:30 this evening. You can reach them. Be patient. They're busy. 303-698-0999.